A 13-year-old female presented with complaints of pain in the right lower abdomen and flank area for last 12 months, and she also had occasional difficulty in voiding. Examination was normal, and we performed CT scan based on the USG finding, which is suggestive of a small right ureterocele. Here in the CT scan images we can see that there is a duplicated system with upper and lower moiety ureter. These ureters appears to be joining just before entering into the bladder, and the upper moiety ureter seems to be dilated and giving rise to a small ureterocele formation. So CT scan images, we found that there was not so much dilatation, and the ureter appears to be joining just before entering into the bladder. So before going for surgery, we also performed a voiding cystourethrogram, which was absolutely normal. The bladder was normal, there was no reflux. So we performed a cystourethroskopy with the help of a 12 French mini nephroscope. Here we can see a bulge on the right ureteric orifice area, and we were able to negotiate the 12 French mini nephroscope in the lower ureter, right lower ureter. Here we can see we have entered into the ureter. This is the bulge which is visible, the ureterocele. Only one opening was seen. The left ureter opening was absolutely normal. So we also did RGP in this patient, which was suggestive of this. The ureter was normal, there was not so much dilatation. We couldn't find the second opening of the ureter, so we replaced nephroscope with a ureteroscope. We performed a ureteroscopy. This is a lower moiety ureter. Here we were able to negotiate the ureteroscope up to the upper middle junction. Here the mucosa appears to be thinned out. We wanted to identify the second opening, where the ureteric opening, the second ureter is opening, but we were not able to find. At the bulge, we also tried to negotiate guide wire to identify the second opening. In complete duplicated system, the upper pole moiety ureter is giving rise to ureterocele in most of the cases. So probably this is the lower pole moiety ureter, in which we have done ureteroscopy and entered. After waiting for some time, we saw a good bulge which was obscuring the lumen of the ureteric orifice. So at this bulge we took a thulium fiber laser and we incised a small portion, just made an opening into the bulge so that we can confirm whether this is a complete duplicated system. And after making an opening, we placed a guide wire through this opening. This was basically a case of ureterocele disproportion, in which there is not so much hydronephrosis, a small ureterocele, but the patient is symptomatic. So after placing the guide wire, this is the lower moiety ureter, which is normal, and we gave incision on the upper moiety ureter, which is giving rise to ureterocele. Now we have entered into this upper pole moiety ureter. The guide wire is in the upper pole moiety ureter, and another guide wire is placed in the lower moiety ureter. So this is basically the anatomy of this patient: a small ureterocele at the distal aspect of the upper moiety ureter, which is obscuring the lumen, which is obstructing the lumen of lower pole moiety ureter also. So initially it was difficult to incise the opening, so we placed a guide wire. Guide wire gave us traction, so we further enlarged the opening, and this patient enlargement of the opening was sufficient. So we further enlarged the opening, and the advantage of giving incision with the help of laser is the chances of closure of the opening is very minimal. We also placed a digestant for 2 weeks, and after 2 weeks we removed the digestant. Patient was completely symptom free. So it was a typical case of a double moiety ureter ureterocele, where after carefully examining we were able to identify the anatomy, and with the help of thulium fiber laser we incised the ureterocele. Thank you for watching.